Hello, my name is Julie Hebert. I'm the agent for LCY Elastomers, and I'm here to go over your group insurance benefits. My name's Julie. There's my contact information. My husband, Stephen, works with me. There's his information, and also my dad, Jim Hall, and there's his contact information. If we can ever help you, if you have any trouble, need assistance, we're always here and ready to help. So some of the plan highlights, LCY is going to continue their coverage. The medical coverage will stay with UMR as a division of United Healthcare. The dental plan will also stay the same. Most of the benefits have actually remained the same for several years. The last time LCY increased payroll deductions was in 2020. So there were some slight adjustments in the payroll deduction this year. You'll see those below. There's your biweekly payroll deduction amount for yourself, employee and spouse, employee and child, employee and family. Open enrollment occurs during the month of December, and it's always effective for January 1 of the following year. So you see there that we offer the medical, the dental, the cafeteria plan, the short-term disability, long-term life insurance, voluntary life, and accident, death, and dismemberment. All of the disability plans, the long-term, the life, and the voluntary life insurance are through MetLife. Everything else is administered through UMR. So the medical insurance, as I mentioned, is through UMR. It is a PPO plan, which means that you can go to any doctor or hospital that's in the PPO network. You also have out-of-network benefits. It is important that you try to utilize in-network providers that are in the United Healthcare network whenever possible. You'll receive the lowest cost under your coverage, and it's also best for the plan overall. So to find in-network providers, go to umr.com and select United Healthcare Choice Plus Network. You can search by city, state, or zip code, and then you can follow the instructions there. Please note that all outpatient surgery and day surgeries do require pre-certification. This is a process where your doctor's office gets in touch with UMR and makes sure that the facility and the procedures are all approved and at the lowest cost for you and for LCY. Here's a list of benefits. So in each year, you have a calendar year deductible of $700 per person. You also have a deductible per family of $2,100. You have coinsurance of 80% and maximum out of pocket of $4,700 per person or $13,200 per family. So what this means is, like, if you go and had to get maybe an x-ray done, it would be subject to the deductible of yourself up to $700. And then once you paid that $700, you would pay at 20%. UMR would pay at 80%. The most you would pay in a calendar year is $4,700. On a family plan where you have, say, 4 family members, each person has a deductible and a maximum out of pocket. $700 is the deductible, $4,700 is the maximum out of pocket. You do have a combined maximum. So say you have 6 family members covered under the plan, the most you would spend in your deductible is $2,100 or $13,200 for a maximum out of pocket for the family. If you go see your doctor, it's going to be a $30 copay. If you have maternity, newborn care, lab, x-rays, hospital, outpatient care, ambulance, home health, all of those things are paid. They are covered 80% after you've met that individual deductible. Same for inpatient hospital and outpatient stays. Urgent care copays are $30. The emergency room copay is $300. So we encourage you to find an urgent care close to you and close to where you work that are in network that you can use in a time where you need to see a doctor quickly and maybe can't wait for your next appointment at the doctor's office, but maybe it's not a life-threatening emergency. We'd rather you pay $30 than $300. There's also a specialist care copay of $80. Then this column lists the out-of-network costs that are there for you, but hopefully you're doing your homework ahead of time and making sure you're staying in network. All wellness exams are paid at 100%. This includes immunizations, routine diagnostic testing, mammograms, colonoscopies, hearing aids, vision tests, those types of things are all covered at 100%. You can also get a tobacco cessation drug covered at 100% if it's something that you need help with. There's also some extended women's health services listed there. For your prescription drug benefit, it's $10 to get a generic, and $30 and $60 to get a preferred name brand drug, depending on the level of the prescription. And specialty medications are available at $100. There is a mail order subscription service that's available. And there's the Wise Choice RX number. If you have any questions about your prescription care coverage, we encourage you to call them and talk to them and make sure that you're receiving the most benefit out of your prescription coverage. Urgent care facility. You should locate an urgent care facility near your home. As I mentioned, Teledoc is a feature that's available to you where you can call a doctor and they will call you back. The copay for that is just $10. This is a nice thing to do for non-emergency medical issues like colds, flu type symptoms. Maybe you have a dermatology type issue where you have a rash, or maybe you have a cut that looks infected. These are all things that can be handled over Teledoc, and they can call the prescription into you for you, and you don't ever have to leave your home. So there's some information on that. As we mentioned, the pre-certification is required. Here's some information from UMR about umr.com. It's a great place for you to go look at your coverage, look at your temporary ID card, to look at claims and benefits, and maybe even help you find a provider in the area. So there's some information about that. Easy to get an ID card and built-in information about your health and your health center. This is telling you how to find a provider. You can go to umr.com and find a provider and look for one that's in network. This is encouraging you basically to use the right healthcare services. There is a nurse line that's available to you 24/7. That information is there for you, and it is a zero cost. Then there's also the Teledoc services that are actually $10 per visit. The urgent care is available to you for $30, and you can also go to a doctor for $30 or a specialist for $80. Then an emergency room visit is going to be $300 plus the co-insurance. Here's some more information on Teledoc, how to get signed up, and some of the things that they can help you with over the phone. Here's a great list of preventative care services. So these are all things that are available to you for free that you already included in your coverage. So you might look at the list and make sure that you're taking advantage of things that are already available to you. Health, women's services, children's health services, and those are all covered at 100%. Here's some information about OptumRx. That's the pharmacy component of your medical coverage. OptumRx.com. Again, you can go there and get some more information about your prescriptions. There's an OptumRx app. Of course, there's an app for everything these days. It's not included in these slides, but UMR did recently come out with an app for their services as well. Dental care services is also provided through UMR. It is a PPO plan, so you can go to any dentist. Of course, you're going to receive better benefit for your dental dollar if you go to an in-network dentist. You can get your teeth cleaned twice a year and get x-rays done at no cost to you. If while you're there, they say, oh no, Julie, I'm sorry, you have a little filling that we have to do, you're going to pay at 20%, they're going to pay at 80%. You do have a calendar year deductible of $100 per person. If that billing actually ends up being a crown, excuse me, they're going to pay at 60% and you're going to pay at 40%, and same for orthodontia. You have a $2,000 annual maximum on your coverage and $2,000 lifetime coverage on the orthodontia. This is telling you that you have the ability to sign up for a flexible spending account, also called a cafeteria plan. The maximum you can contribute to the FSA is $117.31 per paycheck for 2023. You do need to enroll each year. This is something that you spend or lose by the end of the year. So you can roll over up to $610 to the following year, up till April the 30th of the following year. But be sure you estimate your cost and be kind of conservative with that so you don't end up with money you can't use. LCY does provide each employee with a short-term disability benefit. It's self-administered, but it's administered by UMR, but paid for by LCY, the plan will pay 80% of your normal pay for 13 weeks if you're disabled. Benefits begin on the 6th day of disability and are payable back to the 1st day of disability. After that short-term disability expires at the end of 13 weeks, you do have a long-term disability policy that will pick up. The benefit is 66 2/3 of your basic earnings, up to $10,000 per month. And the benefit will be paid as long as you're disabled until you reach eligibility for Social Security retirement benefits. It begins after 90 days of disablement. And this is through MetLife. LCY does generously provide each employee with 2.5 times your annual salary in life insurance, up to a maximum of $425,000. It does include an accidental death and dismemberment rider, so that if you were killed in an accident, you would actually receive 5 times your pay. Your family would. It does reduce at age 70 and then again at age 75. So we encourage you not to name minors as beneficiaries, because if they're under 18, it creates legal issues if you were to pass. Please try to name a trusted individual that will use that money to care for your children, if that's who you want it, the beneficiary to be. Dependent life insurance is also paid for by LCY. They cover your spouse for $10,000 and each eligible child for $5,000 up to age 26. And this can be purchased for $3.20 a month. Then you also have the option to purchase additional life insurance. That's a voluntary life insurance through MetLife. You can elect to insure yourself from $10,000 to $500,000 in increments of $10,000. $100,000 is the guaranteed issue without any medical questions when you first apply. So we encourage you to take at least the $100,000 that is a guaranteed issue. On your spouse, you can cover them from $10,000 to $100,000 in increments of $5,000, but it can't be more than 50% of your benefit. The guaranteed issue amount is $25,000. You can insure your children for $10,000 with no medical questions. So here's some information. As you enroll through ADP, you'll see the pricing that's there for you on those policies. It depends on your age. There's some information about what to do if you leave your MetLife benefits. Here's some information from MetLife about some benefits that they offer. Navigating life's twists and turns. There's will preparation, funeral planning services, grief counseling, estate resolution, and life settlement account. Here's some frequently asked questions about those services. Those are free to you. As I mentioned, open enrollment is in December, and then the changes are effective in January 1. If you're a new hire, you have a special open enrollment window when you're first hired, and then every year in December, you have the option to make changes about who you cover and what items you cover them under. If you do have a change in your life, what we call a life event, you need to make sure you let HR know within 30 days. So if you have a child, you get married, your spouse loses a job, anything where you need to make a change in who's covered and why, you need to let us know within 30 days. Here's some information about COBRA if you leave LCY and the cost of that coverage. Let's see. Oh, here we are. So this is information about Medicare coverage. Hopefully this has given you some overall information about your benefits. You guys have a great package with LCY, and something important to always remember is here's our contact information. We're here to help anytime. We appreciate your business and here to help. Thanks so much.